So I'm going to tell you today one of the reasons, there are a lot of reasons, but one of the reasons why breathing matters. So we're going to go a little bit over anatomy. I'll show you kind of some physiology stuff, and then we'll try an exercise out that can maybe help with it. So one little description here is, you know, when talking about breathing, where is it, what's going on, I generally think of why it's important is because of our, what we kind of refer to our core through here, okay? Okay, so we have our diaphragm right here, one dome, okay? And then we have pelvic floor here, the other dome, okay? And then in between there, we have pressure, right? So if you think about our low back, our core, anything like that, I mean, really, the only bony connection here is this minuscule few vertebrae right here, and that's it. The rest of this stability is maintained by this pressure here. So you can think about it kind of like a piston that's actually having to compress, or like a balloon, and as you compress it, you build up pressure through here. And if this pressure is compromised, then the whole system can be compromised. And so one of the ways that that gets compromised is when we start breathing poorly. So when we start breathing poorly, our diaphragm, we stop using that and it flattens off. And so we can have kind of one dome underneath here, right? But we don't really have that dome over here, so we have incorrect pressure. So it actually starts shoving down into kind of this pelvic floor area and putting more pressure into our low back. And that's just one of the ways in which breathing can really affect everything in kind of the core system. Okay, so I want to give you a little exercise to go off what we were talking about earlier, which is trying to create more of that dome shape with the diaphragm instead of kind of that flatness, okay? So help with that pressure. So we're going to come down right here, okay? Knees up, nice and relaxed. You're going to place your hands just kind of along the lower rib cage right here, okay? And so what I want you to do first, you'll take a few normal breaths, and then when you breathe out, you're going to breathe out kind of like you're breathing into a balloon, okay? So it's going to be a long exhale. So you go, and then as you breathe in, I want to take those hands, put a little pressure into the rib cage, just a little bit, not a lot, and then you breathe in. And then you breathe out. Put a little pressure with the hands, and then breathe in. Okay, so what that does, it activates that diaphragm a little bit more, helps with that dome shape. I only want you to do this 2 or 3 times, no more than that, because if you do it more than that, then you can get a little bit dizzy.